Well, hospitals across the south have been working to develop innovative ways to cut waiting lists. In Dorset, teams are planning to use part of a shopping centre as a Nightingale-style medical site to process large numbers of patients with simple issues. Earlier, I spoke to Debbie Fleming, Chief Executive of the Poole, Royal Bournemouth and Christchurch hospitals, and I asked her to explain exactly what they were going to do.
So we're really excited about the opportunity to do things really differently by having a large amount of space, building on all our learning from the mass vaccines and the Nightingale centres. We can lay things out in a way that allows us to be really efficient, see patients really well and give a good patient experience, but really crack through those numbers by using space differently.
And what are the benefits then of using a shopping centre rather than trying to see these patients in hospital?
So at the moment, all of our space has been designed in the traditional way within the hospital. The outpatient clinic looks the way it probably looked for the last 20 odd years. Coming out of COVID, we were really worried about the large numbers of patients waiting, some of them for a very long time, and we don't want to be adding to those waiting lists. By setting up the space completely afresh within the shopping centre area, we can design it so that every clinician is used to best effect. We have consistent pathways. We can use different people at different points, including volunteers, to make sure that we really get through the numbers, do what we have to do at that point in time, but see far more patients than we would normally see in a traditional hospital setting.
Presumably you've got to move staff to the new setting. So how does that speed things up rather than slow things down?
So if we look at our staff, fundamentally, we can only do this because our staff are so excited about it, and our clinicians are really, really keen to come into this place, which is going to be our hotbed and our test bed for innovation. So we've talked to staff who at the moment are facing limitations. The social distancing means that we can't do things the way we normally would do, so numbers would be lower. But by coming out of the clinic, not only can we get the numbers back up, but we can see even greater numbers with the same number of staff, or perhaps with a few additional staff of different background or skill set. We can do many more people through one session than if they were in the hospital setting.
If you're trying to speed things up, is there a danger that certain things might be missed?
So things that patients can do for themselves without having to speak to a member of staff, without having to come in. We want them to do everything we can remotely. We want to empower people so they're in charge more of their own pathway and care. But by having things consistent, by doing things in the same way, wherever they go along that lane, we know there's less chance of error and we can actually do things better for patients. But I would say as well, we want to make it a good experience. It's not just about getting the numbers through.
Debbie Fleming, thank you very much for your time today.
Thank you very much, Jo.